Hi, I'm David Gottenborg here in Pelican Rapids representing Gottenborg Chiropractic Clinic, and I thought today where I'd go with our discussion would be the complaint of arm or shoulder pain, including numbness and tingling. And it's a big subject. There's a lot of different causes, and so I thought today what we do is we would kind of bring you up to speed on where the symptom is at and what it's likely related to. And in just a few minutes here, I'll bring in my son and we'll use him to demonstrate some of these locations and complaints. Okay, one of the most common complaints when people come in is with hand numbness or tingling. And a general rule of thumb is that when a person has symptoms associated with carpal tunnel, the symptoms are usually involving the first three fingers. Okay? If the numbness or tingling involves the fourth and fifth finger, primarily the fifth, the problem usually comes from inside the elbow, right where my finger is here, the ulnar nerve. If someone comes in and they say, you know, I wake up every night and all of my fingers, all are numb, the arm is sleeping, one of the areas that we commonly then look for is at the very base of the neck. So with Jacob here, we see the outline of the clavicle. Beneath the clavicle, above the first rib, is a compartment that houses not only the main blood supply to the lower arm, but also the main nerve supply. At this point, if the nerve or the blood supply is compromised, you'll have numbness and tingling down the entire arm. Perhaps one of the most common problems, or people come in and say, do I have a pinched nerve? And certainly when I think of someone with a pinched nerve, I always think of lower neck, upper back. So in Jacob's case here, you're exactly right. The nerves that supply the lower arm, including the hand and shoulder, begin at the very base of the neck. And these 4 or 5 nerves form a common nerve that extends all the way down the arm. People that are having a pinched nerve will usually have neck pain associated. In other words, they might say, when I turn back or when I tip back, it exacerbates or it increases the pain or symptom in the lower hand. Another cause that we find a lot is in the upper back, starting probably about mid-shoulder. If you didn't know it, you have ribs this high, and we sometimes find a subluxation or a misalignment of a rib, particularly the top 2 or 3, will usually generate pain to the back of the shoulder, inside the elbow, into the hand. And in closing, I know today we talked about a number of different causes for symptoms in the arm and shoulder. That being said, chiropractors are really well qualified to work with any one of these problems, from carpal tunnel to entrapment inside the elbow, to this compartment syndrome known as thoracic outlet, where we ask for more patient involvement with doing certain exercises. Certainly when we get a chance to look at x-rays, we can give you an opinion as far as a herniated disc or a pinched nerve in your neck. And I think one common problem that goes unchecked is what I talked about, what happens in the upper back in respect to the rib and how it connects to the spine. If you have any questions or if you're having symptoms that just aren't responding, please give us a call, and thank you.
Thank you for watching Wellness for Life.